All right, let's dive into the topic of dealing with abscesses, those nasty pockets of pus that can cause serious trouble. Today, we'll go through the procedure of incision and drainage, or I&D, which involves cutting into the abscess to allow the pus to escape. We will explain what an abscess is, how to identify one, the process for performing an I&D, and discuss how to handle any complications that may arise. First off, why is treating abscesses particularly important, especially in the ICU? Patients in the ICU are already in fragile health, so an infection like an abscess can escalate into something much more dangerous, such as sepsis. Quickly and properly addressing an abscess is crucial to control the infection, alleviate the patient's pain, and prevent it from spreading. So, what exactly is an abscess? It is a localized collection of pus resulting from a bacterial infection. In layman's terms, bacteria invade tissue, your body fights back, and all that fighting results in a collection of white blood cells and dead bacteria, which becomes pus. The body then walls off the area, effectively stopping the spread, but also making it hard for antibiotics to penetrate. Abscesses can appear anywhere, from the skin and perianal area to Bartholin's glands and teeth, and even internally within organs. You'll know it's an abscess if you observe swelling, redness, warmth, pain, tenderness, and that distinctly squishy fluid-filled sensation known as fluctuance. Early detection is key to avoiding complications. The decision to perform an I&D is based on specific criteria. It is warranted when you encounter a localized abscess displaying signs of inflammation, intense pain, the presence of fluctuance, and when there's a need to prevent the infection from spreading. However, there are times when I&D is inappropriate, such as when the abscess is in a challenging location like near the tonsils or deep in the neck, or if the patient has a weak immune system. If the abscess is not yet fluctuant, it is likely not ready to drain, and sometimes small, early-stage abscesses can be resolved with antibiotics. In complex cases, or when an abscess doesn't respond to initial treatment, referral to a specialist is essential. For the procedure, having the proper tools is essential. This includes gloves, a mask, eye protection, skin prep materials, sterile drapes, numbing medication, a syringe and needle, a scalpel, forceps, hemostats, gauze, a culture swab if needed, irrigation solution, packing material, dressings, possibly sutures, suction devices, and a reliable light source. Selecting the appropriate scalpel and forceps while ensuring excellent lighting is critical, as is maintaining sterility throughout the process. So here's the procedure, step by step. Begin by obtaining the patient's consent and clearly explaining the procedure to them. Make sure the patient is comfortable and that the area to be treated is exposed. Clean the skin thoroughly and lay down sterile drapes. Administer local anesthesia carefully, injecting slowly and aspirating to avoid blood vessels. Then make an incision with the scalpel over the most fluctuant area, ensuring it's large enough for adequate drainage and ideally along skin tension lines. Carefully apply pressure to express the pus, use hemostats to break up any trapped pockets, and thoroughly inspect the cavity. If necessary, obtain a culture. Rinse the cavity with saline until it is clean, insert gauze to loosely pack the wound, and apply a sterile dressing over it. Additionally, manage any pain the patient experiences. Post-procedure, instruct the patient to keep the wound clean and dry, change dressings as needed, take prescribed pain relief and antibiotics, and attend follow-up appointments. Advise them to monitor for infection signs. Typically, packing is removed after a couple of days, at which point the wound is reassessed for proper healing. If issues arise, repacking may be necessary. Provide clear guidelines on when to seek medical help, such as increased pain, fever, troublesome drainage, bleeding, or a return of original symptoms. There are times when complications occur, like abscess recurrence, bleeding, persistent pain, infection spread, fistula formation, or scarring. Address these issues with additional antibiotics, further drainage procedures, or surgery if needed. Preventive measures include maintaining sterile technique, properly draining the abscess, and providing diligent post-procedure care.